about designing healthcare applications during a pandemic, a day in the life at Optum. Wanted to, get into some of the things that we go through at Optum. Right now, obviously, everybody is impacted by much of the same things to some degree, but you're obviously going through it in your situation, whether you're a student, whether you're working for another organization, or your kids and teachers, whatever. Everybody's got some situations that they're going through. So in my deck today, I'm going to talk about, you learn a little bit about myself. I'll talk about Optum. I'll talk about how it is to work at Optum. I'll talk about, applying design thinking, which I think is obviously great for this IDEATE and you guys' topic and focus today, and yesterday for that matter. And I'll also talk about the changes and how we've been impacted essentially by the pandemic. And then we'll, summarize and get into a little QA. First, about myself. So I'm a senior UX designer at Optum. I've been there for going on 4 years now. I've been doing development work and design and development work for over 18 years. My focus in terms of user experience has been for about 12 years, and particularly within agile teams. And of course, I think I started doing agile with a company called Dialogue, and they're like one of the oldest information retrieval companies in the world. And I was with them for almost 13 years. While I was there, I actually received my Master in Library Science degree from North Carolina Central University. I also got an MBA from New York Institution of Technology. And I did some direct training at Menlo Innovations in Ann Arbor, Michigan. Dialogue was actually bought out by ProQuest at the time. And with ProQuest, I actually helped lead some of that design development initially for about 3 years when we got transferred over. And so got a chance to get further acclimated into the whole user experience world, as well as the agile study, for that matter, the methodology of design. And while I was doing all that, I also got certified in pragmatic marketing, which that really kind of helped open up my mind in terms of how to develop markets and how to develop products, based upon a lot of the similar interactions that you have inside of an agile methodology of design. So at Optum, what is Optum? Well, Optum is a huge organization. I mean, we're a Fortune 5 company, national largest health insurance company, the nation's largest health insurance company. We are Optum is the technology arm of United Health Group. What that means is we generally do all the applications and all of the software development and databases and so on and so forth behind the scenes for United Health Group. And so we're, obviously into their services and really big part of everything that they offer. We generally work on, obviously, customer applications as well as in the healthcare systems and related to clinical and as well as insurance and claims and medical claims for that matter. There are a number of different types of things that we're involved in when it comes to that. We're located right here in Raleigh. Optum's much like a lab in terms of how we're actually set up. So there's no real assigned seats. However, there are a number of different cubbies, if you will, that you can sit down desks that are around. And usually most folks are sitting together as far as their teams are concerned. It was the design of the actual office itself was more of set to be, for co-location and allow for teams and agile teams to really work together. The reality of it, though, of course, Optum is a huge organization. We've got, headquarters in Minnesota. We've got main hubs in Boston, Tennessee, Austin, Texas, Dublin. So we're around, obviously, here in Raleigh. And so we're around, and we have a number of different people spread across the world, essentially. So while it's, our primary, and for myself, was to come into the actual office itself, that's not obviously something that we necessarily have everybody all in the same place. So we work through a lot of services, virtual services already. I would say about 4 days out of the week, most of the time I was in the office prior to the pandemic and taking over. So it was, you know, this whole setup, as I'll get into, is a major change. But to really talk about how we apply design thinking at Optum, I think I'm pretty sure everybody's heard about generally the 6 steps within design thinking. I actually narrowed them down to 4 here, you know, because for Optum in itself, we look at it really, and particularly that 4th set is kind of like a cycle to some degree, because you have to kind of go through that cycle as far as the continuous change that takes place. So the first step in design thinking that we apply is the research, right? We learn about every initiative. So at Optum, there are a lot of different ways that you work. We obviously have products that we work on. We also have actual initiative, you know, short-term, long-term projects that we also work on. So we learn about those projects, and we start with trying to really understand what's going on. So the biggest thing is listening. And then with listening, obviously, is really empathizing with our users, understanding exactly what they need. And that's all a part of it. The next thing that we actually get into is defining the users. And this is really understanding their goals and documenting what's necessary there. You know, there are a lot of different ways to establish what users and how they work with the service. We have primary, your secondary, and tertiary. We generally call it personas. And yesterday was great because I got a chance to meet a team that is in the process of validating their what their solution is. And they were actually working on a solution for tracking students and their health. And their primary users would be teachers and parents. And so, you know, this is one of the things where I explain to them, you got to make sure that you really understand their interactions, their expectations, what are their goals, what are the things that they would want to have, and what are even some of the barriers that might prevent them from doing the types of work that they're wanting to do. So it's great. That's just a really good example of how we would even go into the process of establishing who the users are. The next thing that we get into is ideation. You know, ideation in this case, this is where the innovation starts, right? I mean, this is where after learning about and documenting the user's information, for that matter, we really get into understanding how we can apply and how we can actually address some of the concerns. A lot of times, some of the low fidelity designing comes here, whether you're doing a sketching by hand or using an actual application. This is where some of the ideas to come together. And it's really where the collaboration comes together, because you're working with, for Optum, we work with stakeholders, internal and external in many cases. And so there's a lot of give and take in terms of understanding what needs to be done. And that's a common practice for us. And then we get into the final step, which like I said, with 4 steps, I took the 4th step and kind of combined design, testing, and iteration together, because that cycle, it's going to happen over and over again. And let me just say that the illustrations and all the things that we provide, of course, is really there to support the agile teams in the next step, which is the development. You know, you can do these things either at the beginning, which is in an agile process would be at sprint 0, or you can do it, you know, during the sprint in many cases. It's a lot tougher, I think, during sprints than doing it ahead of time during the discovery period, which gives you the time to actually look and evaluate and actually get some feedback and so on and so forth. But the whole process is really meant to be a cycle. And that sometimes, hopefully, you know, you come out the gate, you do the cycle once or twice or what have you, but in some cases you do need to do it a few times. In this design practice, let me just say that failure is cool, and it's cool to when it happens fast and it happens early, because essentially you're able to shift really quickly and make your designs more acceptable to the problems that you're trying, and more acceptable to the goals that for the user that you're trying to address. And so that's a really important aspect for us. So what's changed? I would say, and this is the interesting part about for Optum. Obviously, like I said before, normally for me, and I know for a number of colleagues, not all, we used to come into the office frequently, most of the week. There are some folks obviously that work remotely and that they're full-time remote. So nothing really changes for them, but there certainly is an uptick. So when I was looking at this particular part, I started thinking it's the where right now in terms of doing the research. Normally, for most projects, I have a number of teams that are remote as well. So they have teams in Tennessee, I have teams in Minnesota, I have teams in Boston. I have teams in Dublin folks that I work with. So they're really all over the place. So with those guys, the virtual communications and those WebExes and things like that are very common. But for the most part, when I was in the office, I was there with a number of different folks, whether they're on my team or they're working on their own projects and own initiatives. For UXDS, which is the department I work for, we have over 160 or so designers on staff, which is great. Most of us, in fact, in the Raleigh office is actually about 8 of us right now. Generally, that size of group, we have our own area in the building. Excuse me. And so, when I'm working with those guys, this is what I normally would see. But now, since the pandemic, and when I'm actually doing research and I'm actually listening into even new projects and I'm starting off things with folks, now I'm more isolated. Technically, this is my setup. You're looking at me right now. That's what it's like. Essentially, there's and by the way, and one thing I didn't ask, should I actually, I can minimize this. Is that better for you guys too? I just closed the screen so I'm not seeing everybody on the side there. I didn't. There's one thing I didn't check as I was going through. But anyway, I hope that is better. Anyway, it's better for me. So this is my now setup as a result of social distancing, as a result of the pandemic. Whether I'm at the step of where I'm doing research and learning more about the practices of an application and what the users are actually doing. This is, the change there is that I'm doing everything from home for me and for many of the employees within Optum. Like I said, not everybody, this doesn't necessarily change for everybody. Some folks, nothing has really changed when it comes to that part. But for those who are, for the most part, co-located within an office setting, this is the new life that you have. And that's a major change even in our process. And by the way, we did in some instances with some projects, we got an opportunity to travel to actually talk with users and things of that nature. So by comparison, that's not happening anymore. The other thing that we're doing that's different now is defining users. We're still doing that, right? But it's more the how, right? So in the past, we would actually have sessions where we gather together before COVID, and we would work together in a more collaborative setting in that way, and we kind of come up with the things that we understand about the users, and we get out. Like I said, we'd actually go in some cases and shadow and see the habitat of the user itself. More of a high architect, more high anthropology architect type of thing, where we go into the actual environment and actually see people working and see how they make decisions and so on and so forth, and using the applications they work on. But that all changed, and so we kind of have to define users still collaboratively, but using more virtual tools. There's a shot I took of one of the nice things that's happening right now is we have a cohort, if you will, of teams that have come in normally we do the what's called the technology development program, where we have teams come in. It's more of a Shark Tank program that's set up to allow for summer interns to come in and learn about our design methodology within Optum. And we have a number of different initiatives that we have them work on in that way. The nice thing that's happening as a result of the pandemic this year is that we've kind of expanded the program. The diversity and inclusion division actually tacked on more students because they realized that a lot of companies have kind of let summer interns go as a result. They couldn't take on more with all the struggles and strains of the economy itself. And so our response was to bring on a few other students to give them an opportunity. And at the same time, what it did for us is allowed for us to look at more social responsible applications that we potentially could develop. Our group in this case is actually studying maternal mortality and how we can reduce maternal mortality, particularly for people of color. So it's a really impactful potential opportunity that we're working on. We're discovering more and more. We're going through 5 or so sprints or what have you. Right now we're up to the 3rd sprint. Actually just past the 3rd sprint, so we got 2 more sprints to go. But the team is working on a proof of concept that potentially could, in fact, be something that Optum can incorporate. So this is one of the great things. There's obviously a lot of bad things that happened during the pandemic. This is one of the great things that's taken place, and this is one of the responses that Optum has had since things have taken over. When we get to the ideation stage, it's more of the what, right? Again, in the past, I mean, we would do things collaboratively. We were right together. So we would get, an actual on a board. We would do these user maps, and we have all the information that we collected about the people. So now we kind of have to go through a period where we're trying to learn how we can actually apply and how we can actually change things. And so this is where we build up the use cases and we establish the scenarios and we identify all the goals and needs of the user. And we say, okay, this is what these users need. This is what the things that we potentially could do. How can we, make it better for them? And we see all the struggles and stuff like that. We have all those things highlighted and stuff like that. So I got a chance to a lot of times sit with users, even sit with members of my own team in this instance, and talk through some of the things that we've learned about our projects. And so this is some of the collaborative work that goes on. Now it's, like I said, because it's the what, the virtual tools that we have to use to go online to actually apply the same types of things that we would have done in person, now we're just doing it virtually. So this is really one of the coolest things, I think, again, that's happening in our practice within Optum. A lot of organizations obviously having to do the same thing, but this is one of the things that I could definitely say has kind of had an uptick, if you will, in terms of how we use things and what we're using now going forward. And then as we get into the design, testing, iteration, this whole section for the most part is interesting. It actually, I'd kind of dedicate this to my VP, Dean Barker, who I talked to a little bit about this whole presentation, of course. And one of the things that he had mentioned that was interesting and the change to him was the asynchronous time span of things, right? Now, we've always had, obviously, email. We always have, like I said, WebEx. We always have these other chat tools that we use to communicate at all times. But I think the work in itself, because we're now working from home in many cases, it doesn't really make a difference, what time we get information. I have to admit, I don't necessarily, I'm not in the strains of it, as I was when I was working in the office in many cases. I'll work and do things at night. And I did things before, I would say before COVID as well, but I think I really do a lot of things more in weird times of the day and night, for that matter. So one of the big things, obviously, in this change is that, yeah, we were at one time all doing stuff within a kind of a rigid span time of day, right? Between 8 to 5, right? This is what you normally would do. So I'm in the office, I'm knocking out stuff. You can communicate with me, you can contact me, I can contact you. For the folks that and the teams that I did work with that were co-located, certainly I had direct connection to them in that way. But now, I mean, really, when I even worked on this presentation, it was like 10:30 at night. And I'm not saying that everybody does that, that's just me. I really love the autonomy of being able to work at any point in time and working, for myself in some cases. But really, innovation, creativity, man, it happens at any point in time. And so when I'm, working through problems and after even coming off meetings or what have you, sometimes I'll take a break, right? I'll say, okay, let me think about this for a little bit. So when I'm noodling on stuff, I'll go back and say, okay, maybe the idea will come to me, later on. Maybe I'm writing down or sketching something, on a piece on a napkin, and then I'll come to it and start working on it at night. That's just the way creativity works, and I think that's one of the major things that's changed within Optum and changed in our process. However, one thing is for sure: we always apply design thinking. And we continue to do it no matter whether the change of the pandemic or what. And so while the where, the how, what, and when may have changed, the design process stays the same. We still do what we have to do. And that's how we get things done. I think that's the biggest thing. So it's allowed for us to be really steady. Obviously, connectivity is a major thing because that can go down at any point in time. We don't control that necessarily, but I think what's been really cool is that when we stay connected, when we are, just like this presentation, just like what you guys are doing now, where IDEATE would have been normally a presentation that would have been a conference that we all could have been attending and you would see me live. Now we're virtual. This is what we got to do. And this is how we move forward. So with that said, I'm gonna stop and do the whole Q&A time with you guys and see what questions you have. All right, let's see. I see some chats. Let's see if that also works. Can everybody hear me still? To make sure. Don't be afraid. Ask questions as you need. Well, let's put it like this. Some of the, I'll just share with you guys some of the questions that I normally get when talking about our practices at Optum. Since the pandemic, clearly we're not meeting as frequently and we're not traveling from office to office like we did in the past. In terms of our interactions now, as I've said, everything being virtual, we've actually found that we, in fact, in some instances, have a higher productivity as a result of people having to work from home. Obviously, because we're a healthcare company and because of everything that's kind of connected to us, some of that is as a result of the times. Certainly with so many hospitals at a strain, clinical services needing patient information, there have been new applications, new initiatives that we've had to be involved in and start to develop. So there's an uptick in all of that. And clearly for us, from a design perspective, what we are developing, what we're working on, in many cases has a much higher, I would say there's higher visibility in many cases, and there's also a significance in terms of the need and to be accurate. So I think that's the biggest part in comparison to, say, some other industries that I've worked in the past. This is not like retail, right? This is not, if I don't present or have something displayed in an appropriate way for a patient, a doctor might miss that information, right? That's way more important than that if you don't see a sale going on for something. And it's not to poo-poo on, you know, other industries and what they're developing, but just to point out how the significance of the work that we're doing here in the healthcare, the Ford Healthcare Company in this case. Does that make sense to everybody? Cool. Good stuff. Good stuff. I can tell. I use Sam as my my signal. Okay. Okay. I see some questions. I'm going to start answering. Okay. Is Optum accepting remote internships? Yes, we are. We actually, you know, each summer we go through, we have an intern program. Obviously, you can go through the technology development program, which is run by Ryan Tyler and Tanya Hughley, which are awesome people. Give a shout out to those cats. You know, the programs, we usually do recruiting for the interns starting in the fall. And we also recruit in the summer. So we generally pull in a lot of our candidates. And a lot of times we do have sessions at Duke and a lot of NC State as well, Chapel Hill. So there are folks that will get pulled in as well, and across other, you know, universities across the country. My team has folks from Carnegie Mellon, Stanford, folks from Alabama. We're basically all over the map when it comes to. I got a team of 8 of folks that are there. So let me see some of these other questions that I see here. How do you think this pandemic and its kind of new work normal will influence what work looks like in the future when people go back to work? You know, the truth of the matter is I'm not sure what it's going to look like because we're still in the midst of the pandemic. You know, obviously we've got to get a vaccine, and that's going to be the primary thing that I think gets us to some degree more normal than we are. But I think over time, and my hope and my prayer is that, you know, we'll get back to a state of normal. I do think that for a lot of businesses and a lot of services that have been impacted by COVID, it may take a little bit more time. And certainly, especially those things where we have to have that direct interaction in itself. But I think, you know, we can work through it. I certainly do also think that if we're able to really accept the standard practices with wearing a mask, washing hands, staying distance from each other. For now, I think that will certainly stay in place. And even after we get a vaccine, I think to some degree, some of those things, those habits, those good habits that we're learning can be applied and keep us out of trouble, not with just COVID, but for any other, you know, diseases that we have. We kind of have to think smarter and prevent, you know, anything, you know, from like this happening again in the future. You see what else I can answer here. I'm going to try to get as many as I can. Okay. So how can we maintain a work-life balance since you have mentioned creativity doesn't stop and you would always work at weird hours late at night? Yeah, I think this is one of the things that I think for everybody, we kind of have to find our center. This is the one thing, and even my direct boss, my director, Mark Forensic, he great dude. He mentioned to me, we talked a lot about cadence and how we work, you know, and how we get through projects and, you know, the timing of things that we do and how we relate to others and build relationships in that way. All of that requires management, right? And so I think with COVID coming into play and the pandemic and how now we're having to work remotely, you know, in isolation by ourselves and working from home, I think we have to come to an understanding as to what works for us and our families. The thing I didn't mention to you guys earlier is that I have a wife and I have 3 daughters, 2 of which, my oldest daughters, one is 20 and the other she just turned 19 today. Literally, today is her birthday. The one goes to Methodist University, the other one goes to George Mason University. They're both home right now, right? This is a weird thing that they're going through too. But I think as a result of having them home, which I love having these guys home, it's just it's my personal thing. But you know, they're going to go back in the fall. They're looking forward to it. They're already starting to plan. One of them is going to be, my oldest is going to be an RA actually. So she's all immersed in it. Of course, she plays lacrosse too, so her whole thing is getting into that. But my point of bringing it up really is that I had to find a way to work from home with them being in the house, and obviously all being around. Sometimes it's tough to find a quiet workspace. My youngest daughter, she plays piano, which all three of them play piano, but the youngest one is all into it, and I have to tell her I'm on a presentation. I got something going on, and it gets loud, and she gets into it. She's her nickname is Libby, so for Liberace, because she gets into it really. So I've got to monitor my quiet space, and we all got to do that. And so you've got to find the best times of when it works for you, when it works for the family, because sometimes just closing the door is not enough. And sometimes you got to turn off your computer. That's something that you got to do. I would say that's a really big thing too. Let me see what else other people are asking, which I think the questions are great, guys. And hopefully I'll get through a good amount of them here. How do you think this pandemic and this kind of new work from home? Okay, I think I answered that one. Is Optum also open to idea of keeping many remote positions in the future? Yeah, I mean, we're in the most organizations and many organizations, we are thinking about bringing folks back, and the management is trying to do it as responsible as possible, and they're trying to make it as safe as possible for us to come back to the office. We're scheduled to come back in August. There are a lot of little things that are changing in the office right now. One of the things we're on the 11th floor to the 14th floor, and of course we got to that means some folks, we got to use stairways, we got to use elevators. And the elevator now you can only get in 4 at a time. I remember back in the day we crowd in, and stuff like that. That's one thing that changes. Bathrooms, for the most part, we're leaving the doors open. We're letting people just, so they don't touch the doors, like that. Little things like that. When we get back to normal, I think even when we do have a vaccine in place, I mean, I think a lot of this stuff will change. We'll have even more normalcy, but some of the things, obviously, the hand sanitizers, which we always had hand sanitizers, we always had wipes, we always had things like, I think we'll still continue to, keep the important aspects of keeping clean. In terms of us all coming together in the office at the same time, that may take some time. We may find that, in fact, for Optum, we've been doing really great with folks staying working at home. I think some people within the organization may even have an opportunity to do more work from home. But our office spaces are really important, and certainly they serve a purpose for us to gather. And so I think we'll be thinking smartly about how we utilize our facilities as we continue on. And that is subject to change, particularly, obviously contractually, contract-wise, in terms of what facilities we continue to use in this case. But it's all good. Okay, so let's see. If you had the chance to work at home in the future, would you prefer that or go back to the office? I'm a guy that loves autonomy. I love working from home. I like working from the office too. So I'm not one of those people that is going to fight you for either one. Yeah, I think I'm creative. I'm probably just as creative as I am at home versus at being in the office, but I don't think it really, for me, it doesn't change. I think that's going to be, different from person to person. And so it's a great question. I would love to see statistics if we did like a survey to see what we do, which we're going to probably wind up doing anyway. Let me see if I can skip down a little further. I may not get to everybody's question, but I'm trying, okay? So just bear with me. Let's see. Great, I'm in Atlanta. I hope I can find someone here as well. There is actually a small facility in Atlanta of Optum. You might want to check it out. I think you still have to go through the UHG's site and Optum site to, for those positions, but nevertheless, you may be able to find a place in there. What's your favorite part of Optum compared to other companies you've worked at? I think my favorite part of working at, this is a different time for me in terms of professionally in my career. The one thing that has been really great with Optum is that I get an opportunity to do things like this. Not that I didn't do it at Dialogue, and because there was a lot of uptick there as far as my interactions with other organizations and professionally in that way, and Progress for that matter. But Optum has been really good about opening up, even the fact that we have really, obviously private information that we work with. And so a lot of proprietary things that we obviously can't share for the purposes of our profession. However, I think the great thing is being able to connect with people. And I think, building those relationships outside of just the day-to-day things that we do, I think is really important. And so from a professional standpoint, in addition to the also continued education and learning aspects, fortunately with Optum, I'm kind of degreed up, so I don't really want another degree necessarily, but there's a lot to learn. And that doesn't stop for me either. So I take courses and I do things that are to further my understanding, particularly within the design realm. And I, just like anyone else, I try to build on the knowledge that I have. So this way, it's more of a continuous thing. And I think, that would be great for you guys just as well, whatever your future endeavors are. Jamal, hi, everyone. I'm currently at TDP intern Optum. So if anyone has any questions for me about the internships, yeah, man, that's right. Thank you, Julia. Julia is actually awesome. I've worked with her and her team. They've got a pretty cool site they're working on, an initiative within the internship program. So I'm glad to see her there. What are some of the advice you can give to students who want to someday be in a position like yourself as a senior UX designer? Listen, I would say, like I said, develop as much knowledge as you possibly can about human interaction. Be open to criticism and critiquing. It's a major part of our work, to be able to listen to people. And you're not always going to make beautiful designs that everybody loves, okay? Accept the change and change with the change. I think that's the biggest thing. Don't be afraid of failure. Failure is like, to me, it's like the bread and butter, man. I get giddy over it because you don't understand. I'm going to come back and smack you now because I know what to do because you just told me. And that's the kind of thing that's a great thing, when you design. Obviously, I'm talking figurative, I'm not talking literal, but it's really cool as a result. So I would say for those who are looking to come into the profession, like I said, learn up, have a soft, manner about accepting critiquing, and look for the failure. So that this way you can rebound and establish designs that really meet the goals and needs of your users. Whatever you do, however you start it, those are the big things that I would think, going forward, that's going to kind of change the world to some degree. So that's good stuff. All right, so let me see what else we got. What are some advice? Okay, so hi, Jamal. I feel like you could be a great motivational speaker. Yeah, thanks, Sam. I hope so. This is good stuff. I hope you guys are motivated. I hope you guys, I give my information at the very end, of course, with the critique and with the QA stuff as well. So feel free to, ping me if you're interested in anything else, if I can help you guys with anything in your future. I think this was awesome. I hope you guys learned a lot. I hope I learned a lot by working with you guys, and I look forward to talking with you guys again. I do have a mentor time at 1:30, just shameless plug. So if you want to talk then, you certainly are welcome to come on board.